GoWell was established in 2004 as a research and learning programme to look at the impacts of housing improvement and neighbourhood renewal on the health and well-being of individuals and families and communities in Glasgow.
We knew that there was a lot of change to happen in the city of Glasgow, both in regeneration terms and in housing terms, probably some of the biggest changes that have happened in a generation in the city. And I think our ambition was to better understand what makes a difference to the quality of lives for people who live in deprived circumstances.
Where GoWell is unique is that, firstly, it's longitudinal. It's set up to go for 10 years, so to my knowledge there isn't a study like that. It's focused on Glasgow and it's looking at particular areas that are fairly deprived in the city.
From the earliest days, it was important that we recognised that we had to take findings and learn from them as we go, not wait to the end of a 10-year longitudinal programme, but when research was being published, to understand it, to analyse it, to work with the academic team to support how it would shape and help influence and inform our programmes.
One of the key values of GoWell is the ability to translate, which is sort of often complex academic research, into policy relevant meaning.
But the questions that GoWell ask are entirely different from the questions our tenant survey would ask. It's all about health, how their mental health is, all about employment if they can't get a job, about training. But the GoWell project seems to tie all this in together.
And what we find is people have good intentions to change some of their health behaviours, either in situations where their house gets improved or where they get moved to a new house. But often those good intentions don't turn into changes in behaviour. And so we've been interested to sort of say to the practitioners that you have some very key moments when you can possibly make changes in people's lives or the way people live their lives. And you produce those moments sometimes by changing somebody's home.
You can create environments that make it more likely that people will mix. You can create environments that make it more likely that people will feel safe. And you can create opportunities that are attractive to people and make them feel they've got a valued role in society. And these are the sorts of approaches that are likely to make a difference to the social health of communities.
The physical, if you like, aspects of regeneration need to be supported by public health interventions and by social regeneration at the same time. And that those latter two things tend to lag behind the physical changes.
But they're not necessarily very complex. They don't necessarily cost a lot of money, but it's important that they're thought about and that people regard them as important and central to the whole process of neighbourhood renewal.
That's one of the reasons why we set up the Craft Cafe, to bring people who were left in their houses, had no one to speak to, and to bring them out and bring them in here where they've met other people, they're doing something.
Building homes in itself is very important. We know having a new home and having a secure, warm, dry, more affordable house to live in is hugely important. But GoWell also demonstrated that the neighbourhood's important, that the environment's important, and people cherish these spaces just as much as their homes. So that supported our endeavours to try to ensure that to meet that tenant ask, that we were doing more in the environment, that we would be not just improving the houses themselves, but the wider neighbourhood environment. Transforming a place is one thing, maintaining it and maintaining standards are equally important. So we've ensured that our neighbourhood and environmental services have been significantly strengthened in the last number of years.
It's not just what you do that makes a difference to people's lives and quality of life and their health and well-being, it's how you do it. And we have in a number of places in our study we find that the how question matters as much as the what question. And that's been one of the messages that we've been giving back to the policymakers and practitioners on a fairly regular basis.
By empowering communities, by engaging them, by giving them opportunities to take decisions and influence spend and influence plans, that in itself supports health and well-being. That's another key part in a regeneration journey.
Large investments are being made in Glasgow's communities to regenerate them, to renew them, to create better environments for people to live in. And the real value of GoWell is that it gets to the core of all of that, sees what difference it's making to people's lives, and gives us a sense of whether this focus is going to help improve the city's health and reduce the inequalities that exist within Glasgow.
The focus of GoWell on Glasgow certainly shines a light on some of the most deprived communities in Scotland, not just in Glasgow but in Scotland as a country. And we've GoWell have produced a lot of analysis which shows that the findings are transferable.
And I'd like people to look at Glasgow and say, that's a city we can learn from. Not only to think about Glasgow as a deprived city, but as a city that is improving and that other people can learn about what works from Glasgow.